George Kilpatrick Inspiration for the Nation, celebrating people that we feel good about. November is Diabetes Awareness Month, and we welcome Matthew Jones, who's a family nurse practitioner at Syracuse Community Health. And briefly, Matt, tell us what your role is at Syracuse Community Health and the work you do in the community.
Yeah, absolutely. Well, thank you so much for having me tonight. As a family nurse practitioner, I provide care really and actually our adult medicine department. And I take care of both acute and chronic health
Mm-hmm.
conditions.
Mm-hmm.
And, this could be hypertension, high cholesterol levels, screenings for prevention of different cancers that we see in our populations.
Mm-hmm.
And of course, the big topic for discussion tonight will be diabetes. And that really impacts a large majority of our patient population here. And we're really making positive moves to kind of combat the diabetes uh, population numbers that we have and try to reduce our uh, overall diabetes patients here, right? Our goal is to try to work on that and getting our A1Cs down. So that's when I say, working on our patients, we're trying to get those A1Cs down.
A1C is important. So let's back up a little bit. A lot of folks, old school, will say, you got the sugar, right?
Yeah, the sugar. Okay. Yeah.
And so what did they mean by that?
Yeah, sure. So, we look at hemoglobin A1C that looks like the glycosylated red blood cells, right? Really, how sweet are you when you say, you got the sugar, right? And so, the American Diabetes Association, when somebody have a diagnosis of diabetes, especially type 2 diabetics, for example, will be an A1C of 6.5% or greater. Now, we call patients who are pre-diabetic with an A1C really of 5.6 to 5.7% up to that 6.4%. And then, to confirm somebody with type 2 diabetes, really, that would be the main focus of our conversation, will be type 2 tonight, is 6.5%. And that looks at a 30-day average of pretty much the glycosylated red blood cells and what your blood sugars are over that 3-month window.
And so you've said we're focusing on type 2 and type
Yeah.
1. Type 1, and what's the difference?
Yeah, what's the difference? Yeah, so really, in simple terms here, what this is type 1 is really when, you have autoantibodies and your pancreas doesn't produce any insulin. Now, that's type 1, okay? And in type 2 really is that when, you have a high, blood sugar circulating in your blood and high blood sugars, well, your pancreas can't keep up with the demand from the load kind of coming in, right? So with high blood sugars, you become somewhat, insulin resistant and taking glucose up by the cell. So what happens is the pancreas is like, hey, I can't keep up. I can't keep producing so much insulin. And that's how you get these high blood sugars. So you are still producing insulin, two, not as much as a normal healthy pancreas. And type 1, you don't produce any insulin on your own whatsoever.
And so we used to hear these different terms, right? We
Yeah.
used to hear type 2 as adult onset diabetes, and then we heard type 1 juvenile diabetes. Are we still saying those things?
No, we're not. There is something called late onset type 1 that you may hear of, or LOT, or type 1.5. You may we still see those cases. Really, the juvenile, obviously, in pediatrics type 1, but obviously with the obesity rates going up in our pediatric patients, for example, you will start to see, I can tell our pediatrics department will say, absolutely, in our nutritionists, that we're seeing more type 2s in the pediatric population with obesity rates going up as well. So it's multifactorial there, but there is type 1s that you might see late onset, that can happen.
And we don't know what causes people to have diabetes.
Well, I mean, in some sense, we know, right? Type 1, we're kind of, inborn with it, right? Your pancreas can't, produce any insulin, and we know it's our own autoimmune system that, is attacking those cells. In type 2, we know a lot of lifestyle modifications, a lot of preventative factors, watching our carbohydrates, watching that bread, the pasta, the sweets, cutting back, making sure we have a healthy, balanced diet. Do we really know, at this point, is there a cure, or is there, any of these factors? There's a lot of research out there, and or preventing, the progression of diabetes, but we really don't truly. But we do know that usually, type 2 is more preventative,
Right,
right?
right, right.
Yeah, that's the big key, is preventative in type 2.
We hear things like diet, exercise, nutrition,
Sure.
and some of the myths, right? So let's go through some of those, right? So first of all, does sugar cause diabetes?
Yeah, absolutely. So our diet is the biggest game player here, right? Does processed foods, the ultra processed foods play a factor? 100%. What we put in our mouth with our nutrition truly it can lead to the progression of becoming diabetic. That's why, you hear this, pre-diabetic stage, right? As, sugars go up, we're putting on weight, we have more, adipose tissue or fat cells. As these things are happening metabolically with our own body, hypertension, hypercholesterolemia, when all these conditions, elevated, that's cholesterol, all these things are starting to come together. And they almost culminate to make, unfortunately, I hate saying this, the perfect storm, right? Then you can develop what we call metabolic syndrome. And so, there's a lot of different components to this, but yes, it's simple fact is what you put in your mouth is so important.
But I always heard people say, so I'm going to ask this again. Again, I said, does sugar cause diabetes? And you gave me a nice answer, but I've
Yeah,
always heard that it doesn't necessarily cause it, right, in and of itself, because you mentioned a lot of things. You said breads, pastas, rices,
yeah,
processed foods,
sure.
those factor in. But people think that you can't have sugar necessarily, but you can, but you can't. And so
Yeah, sure. It depends on the grains, right? So it depends on,
right,
what type of grains and things that we're looking at, whole grains, right? We're thinking all of our white starches,
right,
those are your driving factors, right? At the end of the day, we break these down. When you look at, what is sugar, right? A molecule at the end of the day,
right.
carbohydrates. So
Converting to sugar. Yes. Yeah.
converting, yes.
Yes.
So when we
Yes.
look at the breakdown, right, having, I guess, one thing to think about, I guess, is like white bread, obviously compared to whole wheat bread, right? There's more nutritional benefit there. You can see low carb breads, for
Right.
example,
Right.
and those types of things. So I will tell you, does sugar, right, cause diabetes? And in my philosophy and in my work, the answer is yes.
Oh,
It
it
really
does.
does.
It
It
really
does. I don't think it's really a misnomer to say, oh, it doesn't.
right,
Um,
because well, like some if I have a piece of cake and like a lot of people will
is
say,
a piece of cake going to go cause you today to have diabetes? No,
right,
that's not going to happen.
right,
But as you take in food, right? We look at calories, right? We
right.
we look at obesity as excess number of calories in a
Mhm.
diet,
And it's
right?
you. You're fueling the fire, is what you're
You're
saying.
fueling the fire. Yep,
Yes.
that's
Yeah.
what's happening.
Yeah.
You know,
Because
you're,
I think about. I mean, and again, people say, you put too much sugar in the Kool-Aid, or you
mhm,
everything is over sweet and sweet
right.
sodas and um,
Yeah,
all of those things combined with
yeah.
processed foods and
So
pastas and rice and white bread and all that.
yeah. So, I mean, I think now, really cool is that we have continuous glucose monitors that we can use. You'll see people wear them on their arms. You'll hear of a Dexcom, you'll
Right,
hear of Freestyle, Libre. And, you think about this, right? If I eat one piece of chicken, right, with, a half a piece of whole grain bread and some vegetables, but then if I go to Olive Garden and I have a bowl of pasta, two breadsticks, right, and that chocolate cake, and you put those two individuals and you look at their blood sugars, right, you're going to see this spike, right? The sugars are going to go up. And the point is, in a normal pancreas, right, and somebody who has a healthy pancreas, within 2 hours, your blood sugars are coming down nicely back into a target range. And somebody who is diabetic is that their blood sugar will stay 300, 400 for 4 or 5 hours, and,
Right,
and,
right.
and you don't have that drop. And so what's happening is the damage, the micro and what we call macrovascular complications of diabetes, damage to the vessels, damage to the eyes, the kidneys, are when these blood sugars are staying high for such a long period of time. So that's the big factor here. So that's why the correlation of sugar and diet correlate.
Um, Talking with Matthew Jones, family nurse practitioner at Syracuse Community Health. Diabetes Awareness Month. Diabetes prevalent in the African American community
Yeah,
as a high risk. We are at higher risk
we
for
are.
diabetes and other communities of color, but particularly in our community. Matthew, what are we seeing there in terms of numbers rising and how we're
Yeah,
getting under
I could
control?
sure I could tell you of our patients that are diabetic, for example. We There has been 30% of those patients have an A1C greater than 14. That is extremely scary. Okay,
Mm-hmm.
it just it's we are at the forefront. We are breaking that down, and we are really addressing it head on, right? And how do you do that? I mean, it's alarming rates that you're seeing. And is it compliance? Is it the cost of medications? Is it, hey, I can't afford healthy foods. I can't go and exercise. I'm busy taking care of my family. I don't have the support structure to help me. You want to try to make lifestyle changes and big impacts, but when someone's A1C is 14%, that's an alarming where obviously you're going to need multimodal therapy, insulin, and looking at other treatment options, and we tailor the care to the patient. But it's interdisciplinary. We get podiatry. Every patient that is diabetic here, we have a great care team: podiatry, nutrition, optometry. So that's your eye doctor, your foot doctor, and a nutritionist. Every patient that comes into my practice with the diagnosis will see those three specialists as part of the team. So we are really on it.
What are some other myths and misunderstandings about diabetes?
I guess is you know I guess I want to break down the fear that some patients will come to me with about, I'm scared to go on insulin. Insulin's not safe.
Right.
And insulin's a very naturally safe hormone that you produce. Now, does insulin cause weight gain over a period of time? Yes, it does. And we look out for that. But the point is, at some point, people do need insulin, and it is a naturally occurring hormone. So I want to break that down. And then people will say, well, I feel fine. Diabetes, nothing's happening to me, and they're walking around with a blood sugar of 400. But realistically, they're at a higher risk for, heart disease. They're higher risk for renal disease, chronic kidney disease. They start spilling protein in their urine. There are medications that we help preserve renal function and delay the progression of diabetes, worsening renal function with diabetics. You'll hear the big thing right now, and I think everybody wants to hear about the GLP-1s, the Ozempic, the Mounjaro, the Trulicity, or for FDA approved for weight loss, Zepbound, Wegovy. These medications are really, revolutionizing our care that we give, and it is helping with the weight loss and also improving blood sugars. So I guess, that's the big thing is that, um, you know, that I can walk around and it's okay with my blood sugar at 350. Well, no, it really isn't. It's not safe for you to be walking around with a blood sugar of 350.
What should it be?
Yeah, so really, when we look at our ranges, when we see a normal blood sugar between 70 and 100, 2 hours post meal, depending on the patient, 120 post meal, 140, somewhere in that range. But really a fasting blood sugar between 70 and 100, is when you look at guidelines. The other thing is, well, diabetes can't cause a stroke or a heart attack. Well, that's actually false, right? So you'll see the American Diabetes Guidelines recommend even putting somebody who is diabetic on statin therapy or cholesterol medication, maybe even a normal cholesterol panel, because it prevents the plaque from rupturing off the vessel wall, and it stabilizes it to prevent, having a stroke. So I want to, understand the grave risks associated with long-term poorly controlled diabetes. And the other thing that I can tell you that is a fact is as your weight comes down, your blood sugars improve, as does your blood pressure. So I
Yeah.
want to put that out there.
Matt, one of the things that you talked about were some
Yeah.
of the medications, the Wegovy's, the Ozempic, right? And
Mozambique, yeah.
right, which so many people have discovered for weight loss. There was a shortage at one point because they weren't available for the diabetics who needed it. I'm making a general statement. I know there's more science than that, but there was a time when it was such high demand for these medications. One
Yeah.
of the medications that I know has been prescribed is metformin, and
Yeah.
it caused people to have such discomfort with
The
that
I
particular
Yeah.
medication.
Let me
Yeah, yeah.
I know exactly what you're saying, George. So metformin is notorious, right? People will say, "Hey, it makes me nauseous. I have diarrhea." Right? These are the biggest things. Well, actually, metformin comes in an extended release capsule, and I recommend when you take metformin, you must eat with it. That is one thing. It is a potent biguanide. It works very well. It does potentially reduce your A1C by 2 percentage points. And the medication does what it's supposed to do. Now, people will say, well, it kills your kidneys. Okay, here's this other thing. We don't put somebody obviously on, we'll look at dose reduction when a GFR, or the glomerular filtration rate of somebody's kidney, the way they filter at, 40, 45. If somebody's GFR is 30, we stop the metformin because obviously lactic acidosis and progression, concerns for, renal compromise. And so, these are conceptualizations that take, but metformin actually is a very, it's a safe drug to be on. Now, are there side effects to it? Yes, there are. But
That's
the
what.
right med for the right patient,
Right.
But
So, are there alternatives to that?
oh
Because
yeah,
people
there,
people just
sure.
get sick. Oh, they just can't take it.
Yeah, they can't, right, exactly. And then you start looking at the other meds. Where is the GLP-1s? Where is that Ozempic and that Mounjaro? Where can we use that? I don't like using sulfonylureas anymore, especially in our older patients, because they can cause lows. And hepatic, if people have hepatic, failure, or their liver is not able to really metabolize a drug as well, you start to be concerned about that. But then, the new meds, the SGLT2s, your Jardiance, your Farxiga, which also have, cardiovascular, renal protective benefits. You'll see this why you use it, and you pee about 250 calories a day in sugar out of your urine. But can it cause a UTI? Yeah, absolutely. There's DPP4s, that's another medication class. So it really there's so many different options there. But the biggest thing I can tell you is lifestyle modification is where
Mm,
the core
mm.
is to management. Do we have to use multiple resources at times? Yeah, we do. But the goal is at the end is for me to start peeling back medications, reducing the amount of insulin demands that we need. Being able to do that as as the GLP-1s are taken over, really working here. We can start to pull back layers of other meds. So the goal is not to just keep adding therapy onto a patient. We don't want to do that. But as a team, sometimes we just got to work together and we get there. And I can tell you, we've had really, it's this, great people with A1C of 14 and now their A1C is like 6.7, 7.3%. My goal, if you are a diabetic, the American Diabetes Association to be controlled is an A1C of 7.0%. But we're making great strides here.
So you talked about simple lifestyle changes like nutrition, getting
Yeah,
exercise,
sure.
reducing your stress, making sure you are compliant, right?
Yeah,
With
absolutely.
Because some people, because they don't like the medication and the side effects, they look for other means, and that
Yeah,
may or may not work. But you got to get checked.
you got to get checked. Absolutely. And my other big thing too that I want to tell patients, hey, you may have a follow-up visit every, 3 months, right? Or whatever the case may be, especially in our diabetic patients. We see them in close follow-up. Or if we're having every, 6 to 8 week visits or whatever the case may be until they're really, in a bit more of a controlled place. Speak to your providers. Don't wait to that next visit. If you're having an issue, reach out to our teams, and anybody, any of your clinicians. Say, hey, I'm really having a hard time with this med. or hey, I have some questions, or hey, I'm scared about insulin. We what we'll do is we'll have a patient come in, and we'll teach them how to do insulin injections, or they'll come in for their once weekly. They'll stop in because they don't feel comfortable doing their Mounjaro shot or their Trulicity shots or changing their CGM, their continuous glucose monitor. We meet our patients where they're at. So that's so important, is that it's okay to say, hey, I need help with this. Hey, I don't understand this again. That was just a lot of information you gave me. Let's break it down together.
And that's how the Syracuse Community Health does that. Do you have any special programs or screenings this month?
Yeah, absolutely. So, this is a big month, right, for diabetes awareness month. So A1Cs are a big thing, and making sure that all of our visits, we are really striving to make sure those A1Cs are done. What I can tell you is we just had a big diabetes awareness festival here. We had multiple reps that we work with in our industry representatives, really do education and talk to patients and meet with them and kind of share what's going on in our world of diabetes management. It was really a big thing. And it was our first annual one, and it was a big success. And the other big thing I want to tell you is men's health awareness, right? The prostate cancer awareness month, right? So for our men, please make sure you come get your PSAs screened for prostate cancer. This is a big month for it as well. So November is the month for prostate cancer screening as well.
As a matter of fact, and I'll get to prostate cancer screening in just a moment. Let me ask
Yeah.
you a couple more questions about diabetes.
Yeah.
Do you offer culturally tailored programs to meet people where they are, different languages,
Yeah,
etc.?
absolutely.
Mm-hmm.
We have translator services that we use. We also, another thing is that, a big push into what we are doing as well as, patients going on insulin pump. Now, obviously we work, closely with endocrinology groups, especially their pumps, but sometimes like Omnipod is one of them, for example, or a Beta Bionics insulin pump is one that really is the right pump for the right patient. We see a lot of success in our community area for this. So we have a lot of different tailored programs. Yes, we use translation services. We can change the language on their continuous glucose monitor receivers. So we really do. We can work with anybody with that. And even I will tell you, our nutrition appointments, the provider will come right down to me and say, hey, I need you to see a patient that's diabetic, and we're working on building a grand rounds program with the whole interdisciplinary team and really looking at our high risk patients.
All right, so let's hit people really hard. So this is Thanksgiving week, so
Yeah,
there are going to be a lot of carbs.
there's gonna be a lot of carbs, right?
So are you saying to patients, I'm going to let you go this week, or do we really need to manage
Well,
our
I think the
carbs this
big
week?
thing is one other thing is that diabetes you don't take a vacation from,
Mm.
right? And so this is something that we have to live with and work with, right? We can't just close the door tomorrow and say, okay, for the next week, that's it. I'm living with diabetes. And there's a mental health component to it as well. So I really wanted to stress that. And so during this week, right, we know that we need to look at portion control, right? We need to look
Desserts.
desserts, right? Maybe have half a piece of that pie instead of that full piece of that pie. Maybe only have half a scoop of mashed potatoes and half a scoop of your stuffing instead of one full scoop of each one, or maybe not have seconds of that starch. So really, it's
That's the
portion
good
control,
stuff, though,
right?
Matt. That's the
I,
good stuff.
I know it is. Listen, I agree. I listen. I can understand that. But obviously the point is to eat smart, right? And you're gonna have the opportunity. You still want to enjoy in the festivities and the food, especially during this time, and you still can. There's a lot of great recipes, healthy, nutritious recipes out there that you can look at. Substitution of certain ingredients, really reading that nutrition label, and that is why it is so important here. We're so blessed to have a phenomenal nutritionist on
Who can
staff,
help?
an RD, registered dietitian that she really works with our patients. And I strongly encourage anybody, if anybody is, listening, just wants to come out and, talk to us and set up an appointment and just want to understand their diabetes, we're here. We'll see anybody.
Because stress, trauma, mental health also affect diabetes management.
Yeah,
How?
absolutely. Yeah. So, living with it, right? If say that you're feared of doing injections, right? That's one thing. Or, hey, a patient who might be quite, feeling depressed. They can't get out of bed. They're, not really able to get through their day. How are they going to take the energy to take their meds that day? Is it the cost of, I'm anxious because I can't afford my $200 copay for my med while I need to make sure that I can afford food for my family? So there's so many different barriers and understanding, when somebody says they have a lifelong illness, right? That's fearful. That's scary. What does that mean? Am I going to lose a feet? You'll see people that lose, have amputations with poorly controlled diabetes, bad infection in the foot,
Because
ulcer doesn't heal.
what happens with poorly controlled diabetes regarding which then leads to amputation? What's
Yeah,
going on?
absolutely. So if you get neuropathy in the feet, for example, and you don't feel, that you get, a cut, and then that opens and it's a wound and it's non-healing, and you end up with like an osteomyelitis or a bone infection, and they have to start, having to do resection from that, because you didn't feel that, tack or something that, accidentally poked you, or something sharp, or, you broke through the skin, and then you end up with a wound, that can happen. People who the other big population is smokers, smokers and diabetics, that is dangerous because of the vascular disease, associated when you start getting vascular compromise. They get occlusions in their artery supplying blood supply down to the lower legs. And you hear people saying, oh, I had to get that bypass, that type of thing. So that's really scary for patients, excuse me, to be honest with you. There's a lot of different moving components to this. And really at the end of this is that, just really have that conversation with your provider, talk
They
about your concerns.
get screened, and
It's
how can family members play a role with loved ones who have
Yeah,
diabetes?
absolutely. Say, hey, make sure you come to your appointments, or hey, I want to come to your appointment with you if that's okay and you're comfortable with that.
Right, right.
Or, that's the big thing. And just encouraging them, talking to them, say, hey, did you get your A1C checked? Or also if people have children, make sure that they're getting screened, right? Say, hey, or we have kids and things like that potentially, to really just hone in on.
Speaking of screening, they can call Syracuse Community Health at 315-476-7921. Do you recommend people book their appointment this week and get ahead of it?
Yeah, listen, I'm happy if anybody wants to come in and be screened. Happy to set up a visit, and willing to see anyone that needs primary care, and willing to help with that.
All right. Matthew Jones is a family nurse practitioner at Syracuse Community Health. November is Diabetes Awareness Month. I also promised a brief mention about prostate cancer awareness screening as well.
Yeah,
Men, get your PSA. Do you also recommend the digital rectal exam?
I do. Yeah, absolutely. That's another component to this. It's not just the PSA, right? You're looking for nodularity on the prostate, asymmetry, that type of thing. And then obviously working closely with our urology colleagues, and making sure that we're expediting our elevated PSA workups, which then usually require MRI and a biopsy of the prostate potentially if there's concern.
All right, 315-476-7921. Matt Jones, family nurse practitioner, Syracuse Community Health, giving you information about diabetes awareness. The support is out there, management is out there. You've got to take care of yourself, and there's some things you can do. Physical activity, 30 minutes a day or something like that.
Yeah, absolutely. As much of the activity, you can tolerate, meaning, that half an hour walk a day, that hour, of physical activity a day is excellent. Even if you're walking around your office, or, around your block, or whatever the case may be, just getting out and being active is so important.
Let's get those numbers down in our
Let's do it.
community. Syracuse Community Health, a partner with Inspiration for the Nation, helping to reduce diabetes and prostate cancer here in the community. Thank you, Matt. Appreciate your time.
Yeah, absolutely. No problem.
Inspiration for the Nation.